Good morning, everyone.
Good morning.
So we had a bit of a baptism this morning, so we had to push the event indoors. Sorry for the close quarters, but we're gonna move along. Thank you, Mayor, for being here. Thank you for your leadership and your support. Thank you to the councilman, Council President McGyver, Councilman Kelly for being here. We also have our partners here from Partners in Health and Seton Hall University. We can't forget our superintendent, Roger Leone, who, without the support of Newark Public Schools, this couldn't have happened. This was a true partnership, and the support and cooperation that we received from Newark Public Schools cannot go without recognizing. I'd like to thank my esteemed staff over there in the back. We have everybody here from our medical director, Dr. Kelly, our dental directors, Dr. Marshall and Dr. Moore, our chief operating officer, Alexandria. We have some of our board members here. We have our providers and our registration staff. I thank everybody collectively for being here today. My name is Ketlin Baptiste Allsbrook, and I am the director for the Department of Health and also CEO for the Mary Eliza Mahoney Health Center. And I'm happy to be here for the ribbon cutting ceremony to open officially the Mary Eliza Mahoney Health Center at Speedway. This could not, again, go without the support of the administration, of course, Newark Public Schools. Here at the Health Center, we're going to offer adult and pediatric care and women's health care. Our services will be available to the public 8:30 to 4 p.m. Monday through Friday. Behavioral health services on Tuesdays and Thursdays from 8:30 to 4, and adult and pediatric care 5 days a week. We have a truly diverse staff that meets and speaks the language of the community, and so we're very interested in engaging the residents of not just the school and not just their families, but also the residents of Bradley Court, the community as a whole, and particularly our West African and Haitian community that is predominant here in the West Ward. So again, I thank you all for being here. I'd like to turn it over to our mayor. I thank you for making community health a top priority under your administration. If you have some remarks.
Thank you. Glad everybody is here. We're nice and friendly in here today. Just obviously Director Allsbrook and all the work that she's been doing, just been laser-like focused on making this happen. So we're excited about that. Thank the whole staff that's here, our council colleagues, Superintendent Leon. Anything we do together, we do well, which is why this model always works, that we have to collaborate as much as possible. And the goal behind this is to be able to bring health care to folks who desperately need it, right in arm's length of where they are in their community. The model of healthcare is changing and should be changing faster than it is. We learned from COVID that people don't have equal access to healthcare, that there's deep inequities in access to healthcare in this state, in this country. Some of it had led to fatal outcomes for residents here in the city of Newark. So obviously we need to make sure that there's more access, more clinics throughout the community. There's a lot of argument about the hospitals themselves, and while I believe they need to be refurbished and redone and stood up properly, I also believe that they should reach out into the neighborhoods and the community to make it easy for people to get the services they need and not necessarily use the emergency room as their primary health care physician and get access to wellness where they are to prevent people from having to go to the hospital, taking care of them right in their backyard. And this is incredible. We intend on doing more of these. There's even plans to put a bus on the street. I'm excited about all of those plans and what the intentions are of our city and what the outcomes are going to be for health in the community. I would be glad to see after all this is done, just look at the kind of outcomes of health in these neighborhoods and see if there's been any real impactful change because of our direct access to health care being made available to residents who are usually underinsured or uninsured, period. So, we're going to service everybody over here. So we're glad to have it. Thank you for being a part of this. I know the folks at Bradley Court are happy that you have access to health care. Look, 50% of the people in the city don't own a car. Right. So in order for them to go to get a primary care health physician, they would have to travel in order to do that, which makes it more difficult. So you can just walk out your house, set an appointment here, and show up. That's incredible, and that's what healthcare used to look like a while ago. I had a dentist on my block, I had a doctor on my block. Yes. I could just go to the dentist and the doctor right down the street from where I lived at, on 10th Street and Clinton Avenue, by the way. Right. So because that has fallen by the wayside, this is what makes this necessary. So I want to thank Ketlin, Director Asbrook, for all of the work that she's doing. I know the staff that helps her make this vision a reality. I want to thank them as well, because this is a home run for us in the city of Newark, and we're looking for more points out of the health department, that's for sure. So thank you.
I told you, he makes us work, right? He stands behind everything he says. And so now I would like to introduce our West Ward Councilman Kelly, if you'd like to share some remarks.
Thank you. I just want to say thank you to all of the partners that are involved. You know, as the mayor said, this is very important, and it's important because accessibility, you know, and once again, I want to thank you, Director. I want to thank NPS, you know, Roger Leone, and our council colleagues, you know, council president, and of course, our administration. The mayor is doing an amazing job. You know, this is what we need, accessibility, you know, accessibility to health care, because it's beneficial. It's beneficial to the residents. It's beneficial because of some financial constraints, or maybe even some healthcare constraints, you know, of moving about. So it's very important to have healthcare that, like the mayor said, is in arm's reach of the residents. And it's also important because it could be beneficial to preventing further health problems, you know, by getting to a problem faster, being able to assess it quicker in your neighborhoods can be preventative measures as well. So like the mayor said, also, instead of running always to the emergency room, which I know my family did a lot coming up, you know, that was my primary health care, is running to the emergency room, because everybody doesn't have access like this. So this is a win-win for our community, a win for the West Ward, but definitely a win for Newark, New Jersey. And I'm thanking you guys for bringing this to our city.
You know, the mayor and Councilman Kelly touched upon a couple of things that are very important here. In addition to providing the health care services that we're going to offer here at Speedway, we're also helping our patients navigate this complex healthcare system. And so for those who are eligible for Medicaid, we connect them. We initiate that enrollment process to Medicaid. And for those who are uninsured, we have uncompensated care dollars. And we have other resources that are braided together to ensure that everyone has access to care, regardless of their ability to pay or their insurance status. And so now I'd like to introduce Teresa Ellis. Ooh.
Just let us know that.
I'll be gentle. Teresa Ellis Wiggins, a community member for the West Ward.
Good morning. And first I have to say thank you to God. This means so much to me, and it's getting me a little emotional, because I service the West Ward community residents, and I see on an everyday basis the mental health challenges on the corners of the West Ward. So, and the teenage pregnancies, and them not going to the doctor until they about to give birth. So having this medical center in our ward is a plus. It's a win-win, not only for the women, but for the men too. You know, because the only way we can be nurturing to y'all is to nurture ourselves. So I want to thank you, Mayor Raz Baraka. I appreciate the opportunity that you've given us, and you have opened up so many doors for the residents of the West Ward. So I want to thank you on that. And Dupree, it counts as nights I call you and run across obstacles in the West Ward, and you answer the phone. So I want to say thank you to every woman that's standing in here. Thank y'all for y'all continuously caring and nurturing of everything that go on in the city, because I know it's an everyday battle, not only to deal with, you know, bringing such programs to the city, but being a woman and a mother and a nurturer. So I thank y'all. To the men, thank y'all for backing us up and not understanding us, but loving us unconditionally. So I want to say thank you to everybody in the room, and we got work to do. Let's do it. Thank y'all.
Okay, now for the ribbon cutting ceremony. Mayor? Oh, I'm sorry. I'm sorry. 1 second. Oh, Oh my goodness. All right, I practiced. I'm sorry. Dr. Kelly, can you please come? All right, this is our medical director, Dr. Kelly.
Good morning, everyone. It is because of people like you, Ms. Wiggins, that we're here.
Thank you.
It is because we are a village,
Yes.
right?
Yes.
It takes a village to get to the next step. It takes us working together as a village, regardless of race, regardless of culture, it takes us to come together to the table and be a village. And that's why we're here. Our dream, and Ketlin's dream, and our staff dream is to provide excellence, to become a center of excellence for our community, where people will come. You will see newspapers saying, this is what Newark is doing. This is what happens to the iniquities that Newark had. And that's why we're here today. So thank you for being here, and we will continue the work that is in front of us today. Thank you.
Okay, for real this time, the ribbon cutting ceremony. All right.